Hello and welcome. Today, we're going to talk about something that so many women experience, but often in silence. We're going to shed some light on a condition called vaginismus, and more importantly, talk about the very real journey toward healing and hope.
So let me ask you, does intimacy feel painful or maybe even impossible? If you've ever felt that penetration, whether it's during sex, a medical exam, or even just trying to use a tampon is a total non-starter, I really want you to hear this. You are so not alone, and what you're feeling is absolutely real.
And this is the most important thing to understand right from the get-go. Vaginismus is not a choice. It's an involuntary muscle response. Think of it like this. When something comes flying at your eye, you blink, right? You don't even think about it. It's a reflex. That's exactly what's happening here. Your body's protective system has just gotten a little overeager, and it's creating this muscle barrier automatically. This isn't about you, your desire, or your partner. Knowing that, truly letting that sink in, is the first huge step toward healing.
Okay, so let's dive into this a little more, because it is so important for you to know that while this condition can feel completely overwhelming, it is 100% treatable. There really is a clear path forward. You know, the experience can be different for everyone. For some women, this has been an issue from the very first time they ever tried any kind of penetration. We call that primary vaginismus. But for others, things were fine for years, and then it developed later on. That's known as secondary vaginismus. Both are equally real and both are equally treatable.
Now, you're probably asking, okay, but why? Why is this happening? And honestly, the answer is usually pretty complex, because vaginismus is really where our physical bodies and our emotional experiences meet. You can see there are a whole range of contributing factors. On one hand, you have the psychological pieces, things like anxiety, maybe some past trauma, or even just cultural messages we've picked up that put our nervous system on high alert. And then you have the physical triggers, things like recurrent UTIs, conditions like endometriosis, or trauma from childbirth or surgery. The thing is, it's almost never just one or the other. It's usually a mix of these things, creating a kind of feedback loop of pain and fear. And that's exactly why a holistic approach is so crucial. We call it the biopsychosocial approach, which I know it's a mouthful, but all it really means is that we look at the whole picture. We're not just treating a tight muscle, we're looking at the biological, the psychological, and even the social factors that are all playing a part in this pain cycle. It's about treating you as a whole person, not just a symptom.
So what's the solution? Well, this brings us to what's recognized as the most effective treatment out there, pelvic floor physiotherapy. It's considered the gold standard because it directly gets to both the physical muscle issue and the neurological, or brain, side of things. So what does this path to healing actually feel like? Well, we break it down into a really clear, manageable journey. We always start with step 1, which is just education. We demystify your body and get rid of the fear of the unknown. Then we move into step 2, relaxation. This is where you actually learn how to release that muscle tension. Step 3 is all about gentle exposure, done at your own pace to rebuild comfort and confidence. And woven through all of it is step 4, support. We make sure your emotional well-being is a priority every single step of the way. To guide you on this path, we have a whole toolkit of proven, evidence-based techniques. This can include things like manual therapy to help physically release the muscles, and biofeedback, which is a cool way to actually see what your muscles are doing and reconnect your brain to your body. We also work a lot on breathing and regulating your nervous system to help calm that overactive alarm system down. It's a really comprehensive approach that makes sure we're tackling the problem from every angle. You know, beyond all the techniques and the clinical side of things, our biggest goal is to help you restore hope. It's about helping you get back to a life where you feel comfortable, confident, and able to enjoy intimacy without fear getting in the way. And for so many of the women we work with, there's a big, heavy question hanging in the air. Can I still have the family I've always dreamed of? It's honestly one of the most common and heartfelt questions we hear. And I want to be so clear on this. The answer is a resounding, absolute yes. With the right treatment, pregnancy is completely possible. Overcoming vaginismus opens that door, both to pain-free intimacy and to the possibility of starting a family. We have been so privileged at our clinic to see woman after woman achieve this goal. Hearing the stories from patients who first came to us feeling hopeless and then later share the incredible news of their pregnancy, well, that's why we do what we do. That hope is real. So, if you're feeling ready to start this journey, it's just so important to have the right guide. And at Ova's Women's Health, this isn't just something we do, it's our area of deep, focused expertise.
We have successfully guided women through more than 2,000 cases of pelvic pain conditions, including vaginismus. That number isn't just a statistic, it represents thousands of individual stories and a depth of experience that means we really understand the nuances of what you're going through. So what is the OVA difference? Well, it really comes down to our dedicated approach. It means we combine that deep expertise in sexual pain with truly compassionate, trauma-informed care. It means that every treatment plan is specialized and backed by science. And that's why we've become a trusted place for women all across British Columbia who are looking for real, lasting solutions. Please don't feel like you have to wait any longer to find relief. I know that taking the first step is often the hardest part, but we're here to support you from the moment you do. Your journey to feeling better can literally start today. If you feel ready to take that next step, it's easy. Just scan the code on your screen. It'll take you where you need to go to learn more or to book your first appointment. Thank you so much for your time.